Hi everyone, welcome to another webisode of The Good Doctor on eZeLiving.com. Today we're going to be talking about a subject matter that I know that a lot of you would want to hear, and that's phototherapy. And to answer this question with me is Dr. Thomas Berger. Welcome to the program.
Yeah, thanks for having me.
So the first question, what is it?
Phototherapy is the treatment with light. So it's nothing to do with taking a photo. Yeah? It's a treatment with different light sources. It can be natural phototherapy like sunlight, it can be artificial light sources. But it basically takes advantage of different wavelengths to treat different conditions such as acne, eczema, psoriasis and so on.
So to get into a little bit more detail, if someone comes to you and they've got acne, how do you use phototherapy to treat it?
Phototherapy is one of the treatment options, for example, for inflammatory, like acne that is very red, very inflamed, where bacteria are involved. And one of the light sources that we use for acne is a blue light. Blue light has a wavelength that is known to kill acne bacteria. So it's basically an anti-bacteria treatment, which works very good as an add-on to other traditional medicines for acne. So
this is a concentration of light that's focused on a location or an area with acne.
Basically,
and what does it do? Does it decompose or break? Or
basically, the way it looks, the phototherapy for acne is an LED screen. So it's a huge screen. It's not a small spot.
Right.
And the patient basically lies down on a treatment bed and then lies under this lamp, and then the light is on for 20 minutes. It's a very low level light, so there is no immediate pain or side effects or so. But the blue light works because the acne bacteria, these propionibacteria, they have an autofluorescence that you can activate with this light, with a blue light, and then they basically die. Yeah, they don't like it to be exposed to blue light.
So for our viewers who are watching, and they may have this question, that how can phototherapy treat vitiligo?
Phototherapy is one of the more common treatment concepts for vitiligo. Vitiligo is the so-called white spot disease, where patients would develop white spots on their skin, suddenly, often in the face and exposed areas. It's very often a problem for people with darker skin types because the white spots are so obvious. The mechanism behind vitiligo is that in the body is some autoreactive T cells, so some immune cells. They would migrate, they would go into the skin and would destroy pigment-building cells, the melanocytes, and that caused the white spots. So what can we do? We can try to push away these T cells out of the skin, and that we can do with a narrow band UVB phototherapy. So the UVB, it's part of the sunlight spectrum, is known to be immunosuppressive. So if we expose vitiligo skin, we can basically push away the autoreactive, the bad T cells out of the skin, and then the skin will recover its pigment.
So in terms of treatment, if someone wants to undergo phototherapy, is it a one-time solution, or would they have to come numerous sessions to completely get rid of the spots?
Usually it's sessions, but it depends on the type of phototherapy. For example, we do photodynamic therapy for certain types of skin cancer, which is essentially a one-stop treatment. Yeah, it's for the more standard phototherapy, like for acne, for psoriasis, and so on, where we would use more like visible light sources or UVB light. It's usually many sessions. It's a treatment that has very few immediate side effects other than...
When you say many, what does many mean?
Many means 20,
okay,
30, something like this.
Right.
Yeah.
So, I mean, is it between 20 and 30, or could it be less, or could it be more?
For certain conditions such as eczema and psoriasis, which is very standard diseases that we treat with phototherapy, it's more than 20 normally.
Okay.
Yeah, so it doesn't make sense to start with 2.
Yeah.
But for like acne, for example, sometimes we need only a couple of sessions, 4 or 5 sessions, just to get a kickstart, and then we continue with more standard treatments. But phototherapy usually is a treatment that shows slow response. It is not something that shows immediate clearance of lesions.
Well, thank you very much for this insightful information. I certainly learned a lot. As you heard from the good doctor, it's not a quick fix remedy. It does take time, and you will need to be patient. On this subject matter, if you've got any thoughts, comments, or questions, please leave them in the comment section down below. Thanks for watching The Good Doctor on eZeLiving.com, where you can find anything and everything lifestyle.